Episode 1 of Doc opens with a bang, literally. A car accident changes the life of Dr. Amy Larsen, Chief of Internal Medicine at Westside Hospital in Minneapolis. Distracted by a text message during a heavy rainstorm, Amy loses control of her car, which flips, leaving her unconscious and critically injured. She is rushed to the hospital for emergency brain surgery. While the operation seems successful, things take a strange turn when Amy wakes up. She remembers her name and that she works at the hospital, but here's the twist. She thinks she's still an attending physician, not the chief. It quickly becomes apparent that Amy has amnesia, with a brain injury wiping out the last 8 years of her life. Cue heartbreak and confusion. The story jumps back to the day before the accident. Amy starts her morning on an exercise bike, multitasking as she calls the pathology department to push for autopsy results on a patient named Bill Dixon. Meanwhile, in the hospital lobby, we meet Dr. Jake Heller, chatting with his colleague Dr. Sonia Mitra about his Halloween plans with his 5-year-old daughter Mia. Mia is going as Elsa from Frozen, and Jake plans to dress as Anna, the sacrifices of being a devoted single dad. Jake and Sonia share a friendly, easygoing dynamic. Then Jake approaches Amy with a cup of coffee and asks if she'd like to consult on a challenging case. Sonia is struggling to figure out what's wrong with a patient named Felicia, a 22-week pregnant woman experiencing severe back pain, fever, chills, and frequent urination. Amy's bedside manner, or lack thereof, becomes apparent when she examines Felicia. She immediately spots what Sonia missed: splinter hemorrhages on Felicia's fingers. Amy bluntly informs her patient that she has a heart murmur and orders several tests. Felicia and her husband Jimmy are visibly shaken, but Jake attempts to ease the tension by asking if they'd prefer a warm, fuzzy doctor or an excellent one. Amy's tough-as-nails demeanor rubs many colleagues the wrong way. She clashes with Dr. Richard Miller, accusing him of making a fatal medication error in Bill Dixon's case. Richard denies the allegation and accuses Amy of trying to oust him, as she's under review and he's her likely replacement. Their animosity is palpable. Tensions flare again when Amy reprimands Dr. T.J. Coleman for giving a patient's family false hope, snapping, "You're a physician, not a priest." She also butts heads with a nurse, demanding she stay late to complete a task. Clearly, Amy isn't winning any popularity contests at Westside. However, she does share a close friendship with Dr. Gina Walker, suggesting a long history between them. Let's get back to Felicia, whose condition deteriorates rapidly, culminating in a seizure during a scan. When Amy recommends a transesophageal echocardiogram to assess Felicia's heart, Jimmy resists, fearing the risks. Amy delivers a cold but honest warning. Without the test, Felicia could be dead within a month. It's harsh, but it gets the message across. As we follow Amy around, we find out that her personal life is equally fraught. She calls her daughter Katie, but their relationship is strained. Katie doesn't answer, leaving Amy visibly frustrated. We also find out that Amy and Jake are secretly dating. They sneak off to the parking lot, intending to hook up in the back seat of Amy's car. Their chemistry is undeniable, and Jake confesses that he loves her. Though caught off guard, Amy says she loves him too. Later, Dr. Michael Hamda, Amy's boss, tells her that a lot of patients have been complaining about her. In fact, her patient satisfaction surveys are awful, and a staff member confirmed a patient's complaint. Amy suspects the patient is Felicia, and the staff member is obviously Sonia. But Michael won't tell her for sure. He reminds Amy that he won't tolerate arrogance and indifferent bedside manner. Being a great doctor won't protect her anymore. Then he orders her to go home and rest, as she hasn't taken a day off in weeks. Reluctantly, Amy heads home, and that's when the accident occurs. While she's under anesthesia, and the surgeons are fighting to save her life, Amy flashes back to a happy family trip with her husband and their kids, Katie and Danny. The memory starkly contrasts with her current reality. When Amy wakes up, Gina is by her side. Amy's confusion is heartbreaking. She believes the car accident happened during that family trip. Gina gently explains she was alone in the car. Amy panics, hyperventilating and talking about her son Danny. Gina and Dr. Flint run some tests and confirm the worst. Amy has partial retrograde amnesia. The last 8 years of her life are gone. The likelihood of her recovering those memories is uncertain. After all, the brain is a complex and unpredictable organ. When she asks to see her family, Gina agrees to bring in her husband and daughter. And guess what? The husband, well, ex-husband really, is Michael Hamda. He tells Amy they divorced 4 years ago. He also reveals that their son Danny died 7 years earlier from a heart condition. Amy's grief is overwhelming. She collapses in tears, unable to process the enormity of her loss. Later, Michael informs Richard that he's been named interim chief of internal medicine. But first, if you're enjoying this recap, please remember to subscribe to our channel. That really helps us a lot. Later, Michael informs Richard that he's been named interim chief of internal medicine. While Richard tries to mask his glee, Michael's stern demeanor reminds him this is a tragedy, not an opportunity. The hospital staff gathers to discuss Amy's condition. Michael tells them that Amy has no memory of the last 8 years. Jake is visibly shaken but keeps their relationship a secret. Gina cautions the team to give Amy space, emphasizing that recovery is a long shot. Amy is moved from the ICU to a patient room. In the hospital corridors, all her colleagues stare at her, and she doesn't recognize most of them, including Jake, who is devastated. Sonia tries to comfort him, and he admits that he and Amy had been secretly dating for 5 months. No one else knew because of her position as chief. Sonia looks surprised, and maybe even a little jealous. In the cafeteria, Michael and Katie look stunned. Katie feels guilty and worries about how her mother will react to the fact that she no longer lives with her. Michael tells her to take it one step at a time. Amy needs their support, and despite their issues, she and Katie always loved each other. Nearby, some doctors and nurses gossip about Amy's situation, laughing cruelly. TJ calls them out for being immature, creating tension with Dr. Peter Douglas. In her room, Amy has another painful flashback to the family trip, which leaves her in tears. Jake finds her, helps her back to bed, and although there's a lot of things he wants to say, he remains silent. Meanwhile, Richard calls his wife to share the news about his promotion. She says she's proud of him, even if it happened under strange circumstances. Let's get back to Felicia. She nearly dies during the test Amy ordered, but luckily, Sonia and Jake manage to stabilize her. However, the couple won't consent to any more tests. Richard blames Amy for Felicia's coding, claiming the test was unnecessary, and Sonia seems to agree, which shocks Jake. But Peter steps in and reveals that the test proved Amy was right. Felicia has infective endocarditis, which requires surgery. Fortunately, Michael persuades the couple to agree to the operation. Jake approaches Michael in the viewing gallery, expressing sympathy for his situation. Michael empathizes with him as well, knowing Amy trained Jake, though he doesn't realize they were romantically involved. Jake wisely keeps that to himself. Elsewhere, TJ visits Amy, and she's shocked to find out he's a doctor. He credits her for inspiring him and helping him get a job at Westside Hospital. She's thrilled to see him and hopes she wasn't too hard on him. TJ claims she wasn't, and hopes she'll return to work soon. Then Amy begins piecing together her past. She finds out that she left Michael, not the other way around, and she also learns that Danny's death was due to an arrhythmia. Gina encourages her to see this situation as a second chance to rebuild her life. Meanwhile, Jake struggles to cope with Amy's memory loss. He looks at photos of them on his phone, grieving the relationship they had. Things are also very tense with Sonia. She accuses him of letting his feelings for Amy cloud his judgment as a doctor, while he criticizes her for betraying Amy during the staff meeting. As the episode winds down, Amy has a brief but sweet encounter with Felicia, who thanks her for saving her life and her babies. It's a small moment, but it gives Amy a sense of purpose. She later calls Michael, asking for his help to return to work. She doesn't know who she is right now, but she knows one thing: she's always wanted to be a doctor, and she's not ready to give that up. Michael promises to support her, but in a shocking final scene, we see him at home with another woman, who's pregnant. That's going to hurt when Amy finds out. And that's it for episode 1 of Doc. Please remember to like this video and subscribe to our channel, and stay tuned for the next recap of another new wonderful show.